You are listening to Hilary Topper On Air, the small business podcast to help you grow both personally and professionally. And now, here's your host, Hilary Topper.
Imagine your child wakes up one morning and can't move an arm or a leg, has trouble speaking, can't taste, is suffering small seizures, or even temporarily blinded. All the tests come back normal and the doctors can't figure it out. This is an alarming trend that's happening now in children and some adults as a result of acute stress due to COVID-19. This is called conversion disorder, and although it's usually temporary, it's a way the brain copes with too much emotional stress. What do parents do? And what do they need to know? I'm Hilary Topper, and this is Hilary Topper On Air. Today, I have the great pleasure of speaking with Dr. Fumi Stephanie Hancock of Bethesda Psychiatric Health, and she's a best-selling author of 24 help books. Dr. Hancock, welcome to the show.
Thank you so much for having me, Hilary. Thank you.
So can you tell us a little bit about yourself and your background?
Oh, wow. Well, I'm a board certified psychiatric doctor of nurse practice out of Arizona. I own a group of clinics. But prior to that, I was a social worker. So which means that I was already exposed to seeing children go from foster care to adoption and just the cyclical, go in and out and in and out. And I was able to see a lot of mood disorders going on. And because of that, I went back to school to do nursing until I got to the advanced practice. And now this is all I do. I see patients from 4 years old all the way to 99 years old. 99
Wow.
years old, yes.
Wow. So let's talk about conversion disorder. What exactly is it, and why is it prevalent right now among children?
Wow. Thank you so much for asking that question. When you look at that word convert, right? Conversion, which means something changing from one state to the other. And so when you talk about conversion in psychiatry, we're talking about people who are exhibiting certain symptoms, but when you take them to a physician, you really cannot find a medical reason for these things that they're going through. So it becomes more of a mental issue, even though what they are exhibiting looks like a physical, a physical thing that a primary care can take care of.
So how do you go about treating this? I mean, first, it's got to be diagnosed, and I'm sure these children, they put them through a lot of different tests before they come to this.
Absolutely. A lot of times, because it is not something that is so known. So I thank you for even bringing it to the forefront, because with the pandemic and everything, kids are being brought to someone like me, primarily going to primary care and thinking, oh, well, they're having seizures. Oh, well, they can't move, or oh, well, they can't speak well. So you have people really looking at other things before even looking at conversion. And so because of that, it's important that we as parents, when we start seeing all these signs that feels like physical, and you're going to the primary care, they say, yeah, it looks physical, but we ran a test, we did an EKG, we did all kind of blood work, we did all things and nothing. We don't see anything there. Then it's time to come to a psychiatric person like myself, because we know that it is more of a mental health issue than a physical issue.
Well, before we move on, I just have to say that I am so appreciative of our sponsors and must take this moment to thank them. Please support our sponsors and tell them that you heard about them on Hilary Topper On Air. Special thanks to the Russo Law Group, the Profit Express with Tim Healy, Pop International Galleries, Gold Bennis LLP, and the Pagalis Law Group. Now, Dr. Hancock, back to you. We're talking about conversion disorders in children. What tips can you offer parents regarding mental health for children as we start to come out of this COVID-19 pandemic?
Wow. Thank you for asking that again. One of the things that I want to talk about is the fact that our children are going through a lot of stress. So it's important that we put our kids in a routine. They need to have a routine as much as, they've been in the house, cooked up in the house for over a year. Some of them have been online, not doing well, so great in online schools. So it's important that as they begin to now segue from an online school into on-site, they need to have a routine. And by that, I mean, for example, if they have homework time, make sure that their homework time sticks to, for example, if it's 2 p.m., let it be 2 p.m. If it's 12 noon that they have lunch, stick to that. If it's playtime, that is 3 p.m., stick to that. They need to, because they're already going through panic because they do not know what's going to happen going back to school. They are 1 minute excited about going back. The other minute, they're not too excited because they've been out of touch for a while. So the anxiety is there. But if you can calm them down and give them routine, then that can really slow down the need to want to kind of, their brain want to segue into, let me find ways that I can cope with this stress.
Right. And are there any other methods that kids can cope, or parents could teach kids, or, how you teach parents to teach kids to cope? For example, do you do any kind of like meditation or anything like that?
Well, some of the things that we do is the breathing exercise is really very great. A lot of our kids, they panic, and so they go into this hyperventilation. I remember several years ago, I had an opportunity to travel to Saudi Arabia, and I worked in Saudi Arabia for several years. And I would see this in kids, but I did not even understand what it was. They would come into class and boom, they'll drop, and you'll see as soon as one drops, the other drops, and the whole class is dropping. I just dropping with incredible amount of seizure. This is the way of coping. So we need to give them, we call it cognitive behavioral therapy, where you take irrational thinking and turn them into rational thinking. For example, you teach them, if they come to you and they say, oh my God, I know I can't make school today because, and they give you something that is irrational, your role is to say, okay, that sounds rational to you, but let's think about that for a second. What could happen if what could happen if what you're saying is true, or what could happen if it's not? So you need to teach our children how to take that irrational thinking to rational thinking by really, you as a parent, making yourself as an example of making the right decisions. Stress management it's a good thing. Exercising, it's a good thing. Deep breathing exercising is also a good thing too. And of course, giving them time to really play with their friends, giving them time to use even the internet is not as bad, provided it's not something that they sit in front of for 11 hours a day.
That was my next question. Is it okay for, kids to use screen time? There's been so many different studies out there that are so conflicting about screen time. Could you just address that a little bit more?
Yeah, let's talk about that for a second. Now, here's the thing. We live in a technology age. We cannot shield our children from it. even in advancement, technology is advancement, right? So there's nothing wrong in giving them time to be there. But of course, you also want to be watchful to understand what they're doing on there. I've often found parents that would just leave their kids and say, oh, they just want to be by themselves in their room. I'm just going to leave them alone. And then you leave that kid alone to his or her own demise, 10 hours on the internet. Now that could smell trouble. So there is nothing wrong in technology if it is used the right way. There's absolutely nothing wrong in that. We've seen kids where they've come together. I have some groups where teenagers come together and they use the technology to come together to talk about their anxiety, talk about depression, talk about bipolar. So there is a great way that you can use the tool. However, depending on the age of your kid, you've got to be a participant in it too. You just cannot do hands off with a 5-year-old and then go sit in a bedroom doing something else while you leave your 5-year-old to play around on the internet for 10 hours.
Crazy. And I guess people do that. And that's so sad. I know for me, getting outside really helps my mental health. Absolutely. Does this pertain to children too?
Oh my goodness. Oh, absolutely. A lot of parents would tell me, oh, he just want to stay in his room. She just want to stay in her room forever. But here's the thing. We have something called vitamin D, right? And the sun is the best way that you can get natural vitamin D. So when you have kids out indoors all day with you have the curtains or the room is dark and everything like that, what happens is that increases their anxiety, it increases their depression. But when they are out there, first, the sun, they get that natural vitamin D that helps to, uplift them away from that depression. Then they also get time to actually breathe and just breathe fresh air into their system. That's also good. Then they're out there playing with others or maybe with their family members and just exercising every part of them. Some of them go through like fake, they call them false seizures, right? And because they've been home for so long, doing absolutely nothing, so their brain, to cope with all that, go into seizure. We really, you need to really see this. It looks like seizure. It feels like seizure. The mother is starting just like, oh my God, what is this? But it is not really seizure. So when we take them out there exercising themselves, when they come back, I think even with our adults, I don't know about you, when I go out and take a walk and come back, I feel a lot better. Mm-hmm. My mind is clearer. And so we have to expect that our children are like that too.
Absolutely. Now, let's just talk about what a parent should do. Okay, so their child is having these seizures or there's things going on and they just don't understand. What would be your suggestion on what the steps are to do for a parent to take care of their child? Is the first step to take them to their general practitioner? Should they see someone like you?
Wow. I tell you this, the very first one is seek help with a psychiatric provider because it is a psychiatric issue. I actually have a mother about a few weeks ago. She actually took a picture because this always happened to the kid, is a 14-year-old, and she will go into seizure at 12 midnight. And they kept watching it that it was always between 12 midnight and 12:15. And so she took a video and actually sent it to me. And I actually literally watched all that movement with our kid. So when you start seeing your kid going through this, I would advise any parent, please seek help with a psychiatric provider because there are so many ways that you could treat this. Seek help with a professional.
Now, I am a big proponent to therapy and psychotherapy, but there are some people who are not. They feel that there's a stigma and there's a shame around this. Can you talk a little bit about that? And if you have any case studies in regard to that?
So here's the thing, because I like to, when we deal with situations like this, I like to talk in the language that a parent out there would understand. Mm-hmm. Here's the deal. This is your kid. It is nobody's kid. You're the one who have to face not sleeping overnight. You're the one who have to deal with the pain of watching your child go through the ups and the downs, right? And so as much as we want to talk about stigma, which is out there, there's a lot of stigma out there, but the truth is we know that right now, where we are right now, particularly with the pandemic, 1 in 5 kids right now are dealing with depression and anxiety, but they're not even telling their parents. Now, 1 in 3 are dealing with seizures, not just seizures alone, but suicidal ideation, particularly in the area that I'm in right now. This is what I'm saying. 1 in every 3 child that comes to see me tell me I have suicidal thoughts, I have suicidal ideation. And I've been checking that and just watching that trend. So as a parent, while we know and understand that there's a stigma because of the pandemic, things are erupting right now that we can no longer talk about stigma. We have to talk about how to treat our child, how to make sure that they're okay. Let me give you an example. About a few months ago, I had a 4-year-old that attempted to hang himself in a closet.
Oh my God.
I want our parents hearing this to sit on that. Hang himself, a 4-year-old. And by the time they caught him, the rope was around his neck. And he'd already stood on that set. Oh. And for some reason, the older sister, a 16-year-old, was going through something, right? So they called me, and I was going through education with her. And something just said, well, ask about him. How is he doing? So I said, well, wait a minute. How's your brother doing? I said, oh, he's in his room. I said, oh, really? I said, oh, bring him out. Let me talk to him. Well, they went in, and guess what? He was right on there with the rope. And this is a kid that had come out 5 minutes before, smiling, laughing, say like everything was okay.
That is so incredibly sad. And this is such an important topic. And I so appreciate you bringing this to my attention and to my listeners' attention, because this is something very, very serious, and people really need to know about this. So, Dr. Hancock, can you tell our listeners how people can get in touch with you to find out more information?
Well, they can always go to pobpsychiatry.com. That is my clinic. And then we have resources there for them that can talk, that they can read. They can even watch some videos that can tell them a little bit about not just myself, about the clinic and what we do. But more importantly, I would urge parents right now to begin to look, particularly now that things are opening up slowly. We need to begin to look for signs of anxiety, signs, and have a talk with our children. Tell them, give them that opportunity to say, look, if you're feeling a certain way, will you share with me so that I can help? It is time to begin to have this conversation and begin to do it at a massive pace, because as the pandemic goes, this is yet another pandemic that is brewing, and many people are ignoring it and the fact is there is no shot. We don't have a vaccination for mental illness. There's no vaccination. We have to deal with this.
So let me ask you something. One last question. Do you take people from all over the country?
Oh, absolutely. There is tele-psychiatry now. So that's the great thing about it. Because of the pandemic, all of our health plans have now kind of opened themselves up to the possibility that we can see patients from different parts. So I have patients that kind of dial in from New Jersey. I have patients in New Jersey. I have them in Wisconsin. I have them in California. So I do have them that dial in. So that's the cool part about this. And this is what also helps with the stigma, right? So if you feel, okay, particularly those who are from the silent cultures like myself, Africa and all those other countries, you have the telepsychiatry where you could do it in your home with nobody, nobody looking, or they'll never know unless you tell them, right? So this is the great way that you can actually use and tap into the services.
Well, we'll be putting your information on the website with this interview. So, but if you can repeat the website one more time, that would be appreciated.
Yes, it's P as in Paul, O as in Orange, B as in Boy, psychiatry.com. pobpsychiatry.com.
Thank you. Thank you so much, Dr. Hancock, for being on the show. This was so informative. This was a real eye-opener and very upsetting, so yes. I do hope that if you are listening to this out there and you see an issue with your child, please give Dr. Hancock a call.
Thank you so much for having me. Thank you.
Thank you for tuning in today's podcast. Check out our websites at drfumi.psychdnp.com or pobpsychiatry.com. Are you in the Arizona area and in need of psychiatric evaluation? Telepsychiatry available at pobpsychiatry.com. Until next time, from your compassionate trauma care maestro Dr. Fumi Hancock, DNP, PMHNPBC, CNP.